today?
Good, how are you?
I'm doing well, thanks. My name's Nicole. I'm a graduate nursing student. Now, Miss Iannucci, do you prefer to be called Miss Iannucci or Ashley?
Ashley's fine.
Ashley's fine? Okay. So you're here today to see me just for your annual visit.
Yes.
So we're just going to talk about some of your past medical history and just review what's going on with your body.
Okay.
All right. Now, what is your past medical history?
I really don't have too much. At one point, the doctors told me that my thyroid was large, and I had an ultrasound and some blood work, and it turns out there's nothing wrong. It's just a little bit larger.
Okay, so you're just keeping an eye on that, no issues there.
Right.
Okay, and then what about your family history? Do you still have your mom and dad?
Just my mom.
Okay, and how old's your mom?
65.
65. And what type of health problems does she have?
She has arthritis. She has high blood pressure. She has irritable bowel, and she just got diagnosed with a hiatal hernia.
Okay. And your dad, at what age did he pass?
75.
And what was his medical history?
He had a carotid stent. He had Crohn's disease. He had a stroke, and then when he passed, he either had a heart attack or stroke. I don't know which one it was. We didn't do an autopsy.
Okay. Well, I'm sorry for your loss.
Thank you.
Now we're going to talk about a little bit about your personal history. So, do you live in a house or an apartment?
A house.
How many stories?
3.
3 stories. Do you live with anyone?
My son.
Your son? Okay. And what type of work do you do?
I work in government. I'm a supervisor.
Okay, and about how long have you been there?
About 6.5 years.
6.5 years? Okay. Talking about your personal history some more, do you smoke or do drugs or drink alcohol?
Occasional glass of wine here and there, but that's it.
Okay, all right. And do you have any activities or hobbies that you like to do?
Just working out.
Working out. How often do you work out?
Probably about 5 or 6 times a week.
Okay, and does that seem to be like your relaxation, helps with your stress, different things?
Yes.
Okay, good. Do you attend a church? Do you practice any religion?
I'm Christian, but
Christian.
I don't go to church regularly.
Okay, okay. And then we're gonna go along and just kind of work our way down. So, have you noticed any problems with your skin, your hair, your nails?
No.
No issues there, no rashes, no abnormal sweating or hair growth?
No.
Okay. And then what about your vision? Do you see the eye doctor?
Every year.
Every year? Okay. Have you noticed any change in your vision, any blurring, eye pain?
No.
Okay. And then, do you see the dentist?
Twice a year.
Twice a year. Any issues with your gum or teeth?
No.
Okay. Any like frequent sore throats? Notice a change in your voice?
No.
No? Okay. Do you get headaches? Have you ever felt dizzy, passed out?
No.
No? Okay. And we're sitting here talking. Any problems with your hearing? Any hearing loss that you've noticed?
No.
Okay. Any pain in your ears, ringing? Nothing like that. Do you get a lot of ear infections?
No.
All right. And then, do you get colds often or have any sinus issues?
No.
No issues there? Okay. Probably just the occasional weather change or something.
Yeah.
Okay. And then you were talking about that you work out 5 to 6 times a week. When you're working out, have you noticed any like chest pain, shortness of breath?
No.
Heart palpitations, anything like that?
No.
Okay. Any frequent coughs? Okay. Have you noticed any swelling in your hands, feet, ankles?
No.
How's your blood pressure do? Do you know what your blood pressure usually is? Is it good, high,
usually
low?
normal.
Usually normal, okay. And when you're doing your working out exercises, how do you tolerate that? Do you do okay? Okay. Have you ever had any cardiac tests done before?
No.
All right. And then, how about your appetite? How's that doing?
Good.
Good. Any foods that you like more than the other? Do you try to follow a specific diet?
I usually try to avoid sugar and not a lot of carbs.
Okay. Any issues with nausea, vomiting?
Nope.
Okay. How's your bowels doing? Do they move regular?
Yep, no issues.
No issues there? No changes in your stool? History of constipation or diarrhea?
Nope.
Okay. And do you see a gynecologist?
Every year.
Every year. So he does the, did he do a pap test the last time you saw him?
Yeah, in January.
Okay. And then with his exam too, do you do any home self-exams on your breast or anything?
No.
Okay, that might be something that you might want to think about. You know, that's important to do. Any history of any sexually transmitted diseases or anything?
No.
And you said that you have a son. You just have one child. Any other pregnancy, loss? No? Okay. And we talked about your thyroid. And do you have any problems like tolerating like extreme heat or cold?
No.
And no weight changes that are out of the ordinary of your diet and exercise?
No.
Okay. And how about your periods? How are those?
Normal.
Normal. Do you take any birth control?
Yes.
Do you take a pill? Do you have a device?
A pill.
A pill, okay, and that seems to help with everything.
Mm-hmm.
Okay. With going to the bathroom, we talked no problems with your bowels. For urinating, any urgency, frequency?
Nope.
No issues, okay. Haven't noticed any blood in your urine, can make it to the bathroom in time and all that, okay. Sometimes this is a little hard to talk about, but we do have to, you know, talk about it. How's your mood been lately?
Okay.
Okay, any history of depression, anxiety?
No.
Okay, and you said you use your exercise, so that probably helps control if you do have any stress from work or life.
Right.
Have you noticed any sleep problems?
Nope.
No, do you have like a bedtime routine or?
Yeah, I usually go to sleep during the week about 10:30.
Okay, and about?
Early for work. I start work at 7, so I get up around 5.
Okay, so you're getting pretty good amount of sleep then there too. And then since you are active in that, have you noticed any problems with like stiffness in your joints, pain, swelling?
No.
Any loss of sensation in your arms and legs?
No.
All right. Any weakness that you've noticed?
No.
And how's your like mind doing? Do you have a good memory? Things are doing well?
Yeah, for the most part, no issues.
Okay. Well, during our visit, since we're together, is there anything else important that I should know about you or that we need to address?
No, not that I can think of.
Any health concerns that you have?
No, not at this time.
Okay, so it sounds like you just have, you know, the thyroid going on, so we will definitely keep an eye on that.
Okay.
And, you know, we'll just follow up as needed, probably just once a year, just to make sure you're doing okay and do your blood work. But if you ever need anything, you can always reach out.
Okay.
All right, well, thank you for the time for visiting with me today, and I will see you in about a year.
Thank you.
You have a great day, Ashley. I'll talk to you soon. Thank you.
Bye.
Bye-bye.